Welcome, everybody, to our webinar. My name is Edward Shin, and I am the CEO, co-founder of Quality Reviews. And for those of you who don't know us, we are a patient engagement company. And I say that as a new twist on our branding. Previously, we focused on real-time feedback for patient experience, and we still do that, but we are evolving into a patient engagement company that mirrors the patient and employee journey across the healthcare continuum. It is my pleasure today to introduce my esteemed colleagues. Dr. Wendy Dean is the CEO, president, and co-founder of the Moral Injury of Healthcare, a nonprofit organization designed to address physician and healthcare provider burnout as well as moral injury. We have Dr. Michael Torres, who is the VP and Chief Medical Officer of AdventHealth in Orlando. Dr. Leila Durr, who is the Director of the Physician or Provider Wellbeing team at AdventHealth, and Mary Dijkstra, who is also part of the AdventHealth team and Director of Medical Staff Services and Provider Performance Improvement at AdventHealth. So welcome, everybody. It's so great to see you. Feel free to unmute. And I am going to first turn it over to Dr. Dean. Wendy, you wrote a seminal article in Stat News in 2018 that just blew up out of nowhere, and it talks about moral injury. So can you remind us again, moral injury, what is it and how is it different or similar to burnout?
So thanks, and I'm really excited to have this conversation with everyone. My colleague, Simon Talbot, and I started thinking about distress in healthcare about 5 years ago. And we were troubled by the fact that when we talked to our colleagues and asked them if they were burned out, they almost always said, no, but I don't have other language for it. Burnout doesn't feel like the right term to me. And so as we started breaking down what the sources of distress were, what we consistently heard, and what we've heard ever since we published our article, is that long hours, I was going to see some impossibly difficult things. What I didn't know was how hard it was going to be for me to get my patients the care that they deserve. And that sense of having your hands tied, of knowing what is the gold standard of care, but for whatever reason, constraints outside of your control, you're not able to get it for your patients. That's the sense of moral injury. And it's, the technical definition is perpetrating, failing to prevent, or bearing witness to acts that transgress deeply held moral beliefs. For clinicians, those deeply held moral beliefs are the oaths that we took to put our patients first. And when those are frustrated, or when we run into walls that keep us from doing our best for our patients, that's where the moral injury comes in. And it's more of a systemic sense than what I think most people think of as in the burnout, in the definition of burnout. That's more of an individual inability to meet the demands that are made on them.
Great. Thank you for clarifying that. So it's kind of burnout focused on the individual, kind of, what's wrong with you, suck it up, be resilient, versus moral injuries. Like, I'm doing the best that I can, but I feel handcuffed and not able to do what I was designed and set out to do. So I think that that's a good reminder for me, at least. The team at AdventHealth wanted to turn it over to Leila, Dr. Durr. You're nodding your head. Tell us a little bit about what you're doing. I know we had a webinar before, and you guys, Dr. Torres and Mary, and you had established the provider wellbeing office or department at AdventHealth in February of 2020. Talk about perfect timing. Tell us a little bit about how you've addressed this pandemic from a provider burnout / moral injury standpoint, and giving us some examples of what you've seen on the front lines, and to tie it back to what Wendy just said, teasing apart burnout versus moral injury and how they may or may not overlap.
Yeah, I'm happy to. And I don't mean to disagree with you, Wendy, but part of it with burnout actually is that how the construct has been twisted around is what has contributed to it being looked at as a personal deficiency or an issue about the individual. But that's not what burnout originally was defined at. When Christina Maslach defined it back in the 80s, it really was that occupational phenomenon that is a result of the work environment that people are in, right? The process and the response that occurs due to the exposure to chronic stressors in the work environment. So in many ways, it is not about the individual, but unfortunately, that's how it's been twisted, because people will talk about like, oh, these physicians are all burnt out. And when you suddenly start using it as a verb, and then it starts to have a flavor of like a diagnosis.